Hi everyone, my name is Anoosha Kishore and I'm part of Group 1 for this case study. My role is a Surgeon General Chief Medical Officer. This is our case study discussing the pandemic of COVID-19. So in December 2019, this is when it started and it goes through until mid-June, July of 2020, and just the rapid progression of the virus. And I will discuss my role as a Surgeon General CMO and how that impacts the public health perspective of what exactly do we do in this situation. So as a Surgeon General Chief Medical Officer, my role is primarily to advise the government and guide the country's health strategy. So my responsibilities include promoting public health, overseeing infectious disease management, and ensuring preparedness for health crises. I would act as a liaison between executive leadership and healthcare teams to make sure that appropriate information is shared with the public and discussing both domestic and international matters regarding COVID-19. It's really important that my role is taken seriously because it's part of shaping and executing the policies of public health. So it's important that I have accurate information that I'm sharing with everybody. So my initial response is to first just make sure that we know what's going on. So confirming the existence of an outbreak and collaborating with epidemiologists and health agencies to understand what is happening. The case study discusses the seafood markets where things started in December of 2019. So following through with that and understanding how quickly things are spreading, who's being affected, what the risk factors are. Things are rapidly changing throughout the process, so it's important to stay up to date with all of that. So initially, it's to understand what information do we have at this point and what can we do with that information and what the next steps are. So it's important to, based on that information, create a national task force to address the spread of the virus. So I would advise health authorities to conduct widespread testing and contact tracing to identify potential cases because, again, this is rapidly spreading. This is a very quick process. It's important to know who has it, what do our numbers look like, what do the case numbers look like, because it's really scary to see what our incidence and prevalence is from a public health perspective, because as information is being updated, and as people are being informed, the numbers are rising. So it's very important to be knowledgeable about what's going on and having the resources to act appropriately. And in response to the high spread of the virus, it's important for me to encourage closure of high risk locations. So in this case, when we're talking about this case study, we're talking about the seafood market. It's also really important to understand the education aspect for the public and making sure that we are communicating accurate information. So I want to ensure that accurate information is very consistently shared and that it's timely. So there will be very quick updates, but it's important to know that even in a couple days' time, from week to week, there could be significant changes occurring, but it's very important that we update that information as we know it so that the real-time updates are occurring. And we want the Center for Disease Control and Prevention, the CDC, to be a very big resource that people utilize to know that updated information is shared, that the news is sharing updated information. But it's also important to take into consideration misinformation. Social media, community members, personal opinions, even from a healthcare perspective, people have different views on what the right thing to do is. So, although we can't control how people react and the actions that people take, it is important that we give them the most accurate information that we have based on our research and our collaborations and our data, and that that's shared with the public so that they can act accordingly based on what we believe is best from our perspective. So I want to make sure that information is updated and it's the latest news, and it allows individuals in the public to know what their personal individual roles can be in this pandemic situation. So social distancing is one of the things that should be informed, that people should understand what that looks like, what that means, and how that has any kind of effect on the pandemic. So these are just some examples of what social distancing can look like and what your actions can be from an individual perspective of washing your hands and maintaining clean habits to reduce the spread of the virus, in the workplace, traveling to work, traveling in general, and even just making sure that maybe you can eliminate some of those group gatherings and going into public places just to reduce the spread, and just understanding what your resources are in order to do that. International collaboration is also very important for me because I want to make sure domestically that everyone knows what's going on and what the proper precautions are. But internationally, considering this is a pandemic, it's not only affecting one country, it is affecting the entire world. So that information, that accurate, consistent, timely information is important worldwide. So it's making sure that global entities are sharing their data and resources to make sure that we are updating everybody. And again, that's talking about the CDC and making sure that updated information is there. So global reporting and adherence to international health regulations is very essential. And that involves vaccination requirements and treatment opportunities across the borders, across the world, and making sure that there are updates regularly. Healthcare infrastructure is also very important for us because when things get really bad and people end up having to go to the hospital, as we have seen with the rapid progression and unfortunately the fatalities, it is very important to know that as a healthcare worker, as someone that's so closely in contact with something that's so closely spreadable, to know that you're being supported and you have the resources that you need. So from a public health standpoint, it's important to know the funding that's necessary, the resource allocation that's necessary. So, money and resources to protect our healthcare workers, and that can involve personal protective equipment, ventilators, testing kits, and just supporting the workers both physically and giving them the proper training so that they know how to act appropriately, and mental health support as well, because it's a very traumatic experience to go through something like this, and to know that you're being supported and that you're being cared for despite how quickly things are moving. It's very essential to know that you have those resources. So this is just an example of some of the PPE options. The respiratory protection is very important in this case when we're talking about COVID-19, and we want to make sure that masks are available. We want to make sure that N95s are available, both for patients and for healthcare workers and for people at home, to know that if for some reason they have to be in contact with others, that they are protected, that they have the resources that they need. And policy recommendations and emergency measures, when we say emergency measures, that is obviously for those situations that are emergent. If people are following the recommendations and the policies like lockdowns and curfews and social distancing and PPE when necessary, it's very possible that the virus can decrease its spread. That's the goal, but also just to decrease the number of people that end up having to be in the hospital and be treated. So it's important that those rules and regulations are being taken seriously. And that, again, is both domestic and international. So we want to make sure that quarantining is something that's discussed so people understand if they have to travel, what does that entail and what the rules are. And if they need to be vaccinated, if they need to quarantine before traveling, if they need to quarantine once they reach their destination, just really understanding the spread of the virus and any restrictions. So these are just two examples of what isolation versus quarantine, how you can keep yourself from getting the virus and keep yourself from spreading the virus. So isolation is when you know you have the disease, and that's isolating yourself so you prevent other people from getting sick. And then quarantining is you're separating and restricting movement of people who are already exposed. So exposure versus actually having the virus. And then surveillance and long-term goals. It's important to know that this is a learning experience for everyone. So as a Surgeon General, I am again making sure that this information is updated, that I'm notifying the public, and I'm understanding the healthcare perspective of what's happening. But the surveillance, going through it and knowing how the virus is spreading, what the variants are, the progress of vaccination, as that's something that is new. It's not like years and years of creating a vaccine. So it's a very complex and really a touchy subject for some people of, what's the right thing to do. So it's important to inform people of what are the warning signs, what are we doing based on the knowledge we have to prepare for future outbreaks. And public health campaigns are always very useful in situations like this, and really in anything related to public health, just to understand what's happening. and to inform everyone what the long-term prevention strategies can be like. And again, that's vaccination, that's social distancing, that's hygiene, that's just taking the precautions because we want to reduce the spread once it's happened. And then just monitoring going forward and making sure that we're monitoring incidence and prevalence globally just to make sure that we're maintaining the public health data. So in conclusion, my role as a Surgeon General and CMO is very important in the outbreak of infectious disease. So the things that I really want to focus on are strategic coordination, public communication, and policy implementation, because I want to make sure that I'm mitigating an impact that this pandemic can have on the entire world. I want to strengthen the nation's capacity to respond to any future health threats based on the experience with COVID-19. Thank you, and these are my references.